All right, everybody, welcome back for another deep dive. And today we're going to be tackling a topic that I know a lot of you are interested in, and that's telemedicine and AI, particularly as it's being used in rural healthcare.
Yeah, it's a really fascinating area, especially now. I think we're really at a turning point with how technology is changing things.
Yeah. And, you sent over some really interesting research for this deep dive. In particular, this paper from the International Journal of Life Science Research Archive. And I'm kind of excited to jump into this and really uncover some of the cool stuff that's happening out there.
Yeah, I think you'll be surprised at some of the applications
Okay.
and the potential, even more so.
Well, I am ready.
Yeah,
I am all ears. So where do we even start with something, this big, rural healthcare transformation?
I think maybe the best place to start is with the why.
Okay.
Like, why is this combination of telemedicine and AI
Yeah.
so important for rural communities?
Okay, yeah, let's get that foundation set. I know from my reading that access to healthcare in rural areas has always been a challenge, right? It's not just about distance, it's about the lack of specialists, the limited medical facilities,
Yeah.
and so on and so on.
You're absolutely right.
Yeah.
And the impact of those limitations is huge.
Yeah.
People in rural communities often face delayed diagnoses,
Right.
difficulty managing chronic conditions,
Mm-hmm.
and even higher mortality rates for preventable diseases.
Wow, that's a sobering thought.
Yeah,
It makes you realize this isn't just about convenience, it's about life or death.
absolutely.
So how does telemedicine actually start to address these issues? I mean, beyond the obvious, seeing your doctor on a computer screen kind of thing.
It's actually much broader than that.
Okay.
I think telemedicine is really about using any kind of technology to bridge that gap in access,
Right.
whether it's connecting a patient with a specialist who might be thousands of miles away,
Yeah.
or allowing for remote monitoring of vital signs, or even providing mental health services online.
Okay, so it's about expanding the reach of healthcare.
Exactly.
But I'm curious, does it actually improve the quality of care, or is it more about just making do with what's available?
That's a great question.
Yeah.
And I think the evidence is growing that telemedicine can not only match traditional care in terms of quality,
Okay.
but in some cases even surpass it.
Really?
For example,
Yeah.
there was a study by the U.S. Veterans Health Administration,
Okay.
and they found that veterans who used telemedicine for mental health care actually had better outcomes and were more satisfied with their treatment
Wow.
than those who received traditional in-person care.
Now that's really interesting. What makes it more effective?
Well, I think part of it is just the reduced stress
Okay.
of travel,
Mm-hmm.
especially for folks in those rural areas who might have to drive hours to see a specialist.
Yeah.
And for certain conditions like mental health,
Okay.
the comfort and privacy of being at home
Yeah.
can actually improve engagement with treatment.
Yeah, that makes a lot of sense. I never really thought about it that way. It's not just about making care accessible, it's about making it effective because it fits into your life better.
Exactly. And, there's also the cost factor.
Right.
Telemedicine can reduce travel expenses
Yeah.
and unnecessary hospital visits,
Okay.
making healthcare more affordable for both patients and the system as a whole.
Yeah. Okay, so we've got telemedicine, breaking down these barriers, potentially even improving the quality of care. But where does AI fit into this picture? It feels like a whole other beast and honestly a little bit intimidating.
I understand the hesitation,
Yeah.
but AI in healthcare isn't about replacing doctors with robots.
Yeah.
It's more about giving doctors
Right.
a really powerful new tool
Okay.
to help them make better decisions.
Yeah.
Particularly in situations where resources are limited.
Okay.
You can think of it almost like
Okay.
a highly skilled assistant
Yeah.
that can analyze massive amounts of data and spot patterns that humans might miss.
So it's more about augmenting human intelligence than replacing it.
Exactly.
Okay, give me a real-world example of how this works in rural healthcare.
Okay, so imagine a small rural clinic
Okay.
that doesn't have a radiologist on staff.
Right.
A patient comes in with a suspected fracture.
Okay.
Now, instead of sending them to a larger hospital
Yeah.
for an x-ray reading, which should take days or even weeks,
Right.
the clinic can actually use an AI-powered system
Oh, wow.
to analyze the image right there on the spot.
Wait, AI can actually interpret x-rays? How reliable is that?
That's a good question. And actually,
Yeah.
AI systems using deep learning,
Okay.
which is a type of machine learning,
Right.
are already as good as,
Oh,
and
yeah.
in some cases even better than,
Yeah.
human radiologists at detecting certain conditions in medical images.
That is wild. So in a rural setting, this could mean faster diagnoses, quicker treatment, potentially saving lives. It's incredible how this tech is really changing the game.
And it goes beyond just reading images.
Okay.
AI can also analyze patient data
Okay.
from electronic health records,
Uh-huh.
lab results, even wearable sensors
Yeah.
to identify potential risks and predict health problems before they become serious.
Hold on, AI can predict health problems. That sounds like science fiction. How does that even work?
It's all about patterns.
Okay.
AI algorithms can analyze massive amounts of data
Yeah.
and find these subtle connections that humans might miss.
Hmm.
So let's say a patient's wearable sensor shows some slight changes in their heart rate variability,
Okay.
and you combine that with some recent lab results.
Yeah.
The AI might flag that as a potential early warning sign of a heart condition.
Wow, that's amazing. It's like having a virtual crystal ball that can see into the future of your health.
Not quite a crystal ball,
Okay.
but it's getting closer.
Yeah.
And this type of predictive analysis is particularly powerful in rural areas
Right.
where access to specialists and preventative care can be limited.
Of course.
Imagine an AI that can alert a doctor to a potential problem weeks or even months
Wow.
before it would have been caught through traditional means.
So we're talking earlier interventions, better management of chronic conditions, potentially preventing those like life or death situations that we were talking about earlier.
Exact.
AI is starting to sound like a superhero for rural healthcare.
It definitely has that potential, but I think what makes it truly revolutionary
Okay.
is how it combines with telemedicine.
Okay.
It's not just about separate technologies.
Right.
It's really about the synergy between them.
Okay, now you've got me hooked.
Yeah.
Tell me more about this like telemedicine AI dream team. How do they work together?
Well, imagine an AI system that can analyze a patient's health data before a telemedicine consultation.
Okay.
So it's highlighting potential areas of concern for the doctor.
Mm,
This allows the doctor to really focus their time
right.
on the most critical issues
Okay.
and potentially even make a more accurate diagnosis, even though they're remote.
So AI is like the pre-game analysis, helping the doctor strategize for that virtual visit?
That's a great analogy.
Okay.
And it goes beyond just diagnosis.
Right.
AI can also be used to personalize treatment plans
Right.
based on a patient's individual needs,
Yeah.
medical history, genetics, and even lifestyle factors.
Wait, AI can create personalized treatment plans? How does it take all those different factors into account?
It's a complex process,
Yeah.
but essentially AI algorithms can analyze vast amounts of data
Right.
to identify patterns and correlations
Okay.
between all these different variables.
Uh-huh.
For example,
Yeah.
they can look at how certain genetic markers
Okay.
combined with specific lifestyle choices and environmental factors
Okay.
might influence a person's response
Hmm.
to different medications or therapies.
So it's not just about a one-size-fits-all approach. It's about tailoring the treatment to the individual.
Exactly.
Right.
And this type of personalized medicine,
Yeah.
powered by AI,
Right.
has the potential to really revolutionize healthcare, especially for people in rural areas who might not have easy access to a wide range of specialists or treatment options.
That's pretty incredible. We're talking about like a whole new level of care
Yeah.
that's tailored to your unique needs. I can see why people are so excited about the future of telemedicine and AI in healthcare.
It's definitely exciting, but I think we also need to be realistic
Okay.
about the challenges involved in making this vision a reality.
Right.
Implementing these technologies, especially in rural areas,
Yeah.
comes with its own set of hurdles.
Yeah, you're right. Every superhero story has its villains. What are some of the obstacles that are standing in the way of this telemedicine AI revolution?
One of the biggest challenges is the digital divide.
Right.
Reliable internet access is crucial for both telemedicine and AI to function effectively.
Okay.
And unfortunately, many rural communities still lack
Yeah.
that broadband infrastructure.
Yeah, the digital divide is a real issue. I've read reports about people having to drive miles just to find a decent Wi-Fi signal. How can we overcome that obstacle? It seems like a pretty fundamental requirement for all of this to work.
It is fundamental.
Yeah.
And there's no easy fix.
Okay.
It requires a multifaceted approach.
Okay.
Investment in broadband expansion is essential.
Right.
And that involves collaboration between government agencies, private companies, even local communities.
So it's not just about throwing money at the problem. It's about strategic partnerships,
Exactly.
community involvement.
Yeah, we need to explore innovative solutions like satellite internet
Okay.
and mesh networks,
Yeah.
which can provide connectivity in areas where traditional broadband infrastructure
Right.
is difficult or expensive to build.
Those sound promising.
Yeah.
It feels like there's a real opportunity for some creative problem solving here.
Absolutely.
But even with the internet hurdle cleared, isn't there still the issue of people having access to the right technology? Not everyone can afford the latest gadgets and gizmos.
You're right. Affordability is another key challenge.
Okay.
We need to make sure that the technology needed for telemedicine and AI-powered healthcare is accessible to everyone,
Right.
regardless of their income level.
Yeah.
That might involve subsidies,
Okay.
loan programs, or even partnerships with community organizations to provide devices to those who need them.
So it's about making sure that the benefits of these technologies are shared equitably. It shouldn't just be for those who can afford it.
Exactly.
Okay.
And then there's also the challenge of training healthcare providers to effectively use these technologies.
Right.
Doctors and nurses need to be comfortable with telemedicine platforms,
Yeah.
understand how to interpret AI-generated insights,
Hmm.
and know how to integrate these tools into their workflow.
So it's not just about having the tech, it's about having the skills and the knowledge to use it effectively. What kind of training programs are being developed to address that?
Well, there are a growing number of initiatives,
Okay.
both online and in person, that are training healthcare professionals
So-
on the nuances of telemedicine and AI.
Right.
Some medical schools are even incorporating these topics into their curricula.
That's great to hear.
Yeah.
It sounds like the medical field is really starting to embrace these technologies. But what about the patients? Are people generally open to the idea of receiving care through a screen? It seems like there could be some resistance or distrust.
That's a valid point.
Yeah.
Patient acceptance is crucial
Right.
for the success of telemedicine and AI-powered healthcare.
Sure.
And it really comes down to education, transparency, and building trust.
So how do we go about building that trust? How do we convince people that this isn't just some impersonal high-tech experiment?
Well, I think it starts with clear communication.
Okay.
Patients need to understand how these technologies work,
Right.
the potential benefits,
Yeah.
and the safeguards in place to protect their privacy and security.
Of course.
Healthcare providers can play a key role
Yeah.
in explaining these things to their patients and addressing any concerns they might have.
So it's about that human touch, even in a digital environment.
Exactly.
Okay.
And it's also about demonstrating success stories.
Hmm.
As more and more people experience the benefits of telemedicine and AI-powered healthcare,
Right.
word of mouth will spread,
Yeah.
and that will help to build trust and acceptance.
That makes sense. Success breeds confidence. But even if we manage to overcome all these hurdles, aren't there still some ethical considerations we need to be mindful of? Especially when we're talking about AI making decisions that could potentially impact people's health.
You're absolutely right.
Yeah.
Ethical considerations are paramount when it comes to AI and healthcare.
Okay.
We need to ensure that these technologies are used responsibly, fairly, and transparently.
Well, that's a pretty big can of worms.
Yeah.
Where do we even begin to unpack all of that?
Well, one key area is data privacy and security.
Okay.
AI systems rely on vast amounts of data,
Right.
and that data needs to be protected from unauthorized access, misuse, or breaches.
Yeah. Healthcare data is incredibly sensitive. We need to make sure it's handled with the utmost care. What kind of safeguards are being put in place to address that?
Well, there are strict regulations,
Okay.
like HIPAA in the United States,
Right.
that govern the handling of healthcare data.
Okay.
And technology is also evolving to provide even more robust security measures, like encryption and blockchain technology.
That's reassuring.
Hmm.
But beyond just keeping the data safe, we also need to make sure it's being used responsibly. I've heard concerns about AI algorithms perpetuating existing biases in healthcare.
That's a crucial point.
Yeah.
AI algorithms are only as good as the data they are trained on.
Right.
If that data reflects existing biases,
Yeah.
then the AI system will likely perpetuate those biases,
Right.
which could lead to disparities in care.
So if an AI system is trained on data that primarily comes from urban hospitals, it might not be as effective in diagnosing or treating conditions that are more common in rural populations.
Exactly. That's why it's crucial to ensure that the data used to train AI algorithms is diverse
Right.
and representative of the population as a whole.
Okay.
We need to be mindful of potential biases
Yeah.
and take steps to mitigate them.
So it's about being intentional about the data we use
Yes,
and making sure that it reflects the diversity of the communities that we serve.
precisely.
Okay.
And it's not just about the data itself.
Right.
It's also about who is developing and deploying
Yeah.
these AI systems.
Okay.
We need diverse teams of
Yeah.
engineers, clinicians, ethicists, and community members
Right.
to ensure that these technologies are designed and implemented in a way that is equitable and benefits everyone.
It sounds like there's a lot of work to be done, but also a lot of potential for positive change.
Yeah.
It's inspiring to see how these technologies are being harnessed to address some of these long-standing challenges in rural healthcare.
It is inspiring, and I think we're just scratching the surface of what's possible
Yeah.
as technology continues to evolve. We can expect to see even more innovative applications of telemedicine and AI that will further transform how healthcare is delivered in rural communities.
Okay, I am officially on the edge of my seat. What kind of future innovations are we talking about? Give me a glimpse into the healthcare crystal ball.
Well, imagine virtual reality consultations
Okay.
that allow patients to feel like they're actually in the same room with their doctor,
Oh, wow.
even if they're miles apart.
That would be incredible. It would really help to bridge that distance and create a more personal connection.
Exactly. And think about AI-powered diagnostic tools that can analyze not just images, but also sounds, smells, even subtle changes in a patient's voice or facial expressions
Wow.
to detect disease even earlier and more accurately.
That sounds almost like something out of a science fiction movie.
It might seem futuristic,
Yeah.
but those capabilities are closer than you might think.
Mm.
And we're also seeing advancements in wearable technology that go far beyond just tracking steps and heart rate.
Okay, I'm intrigued. Tell me more about these super-powered wearables. What can they do?
Well, imagine a wearable sensor that can continuously monitor your blood sugar levels,
Okay.
detect early signs of infection, or even alert you to potential environmental hazards in your surroundings.
Wow, that's amazing. It would be like having a personal health guardian angel with you at all times.
Exactly.
Oh.
And these advancements are just the tip of the iceberg.
Okay.
As AI and telemedicine technologies continue to converge, we'll see even more innovative solutions that will empower patients and providers alike.
This is all so fascinating, but I want to bring it back down to earth for a moment.
Okay.
We've talked a lot about the potential benefits,
Right.
but what about the potential risks?
Sure.
Are there any unintended consequences we need to be aware of as we embrace these technologies?
That's a great question. And it's important to acknowledge that no technology is without its risks.
Right.
One potential concern is over-reliance on AI.
You mean relying too much on the technology and not enough on human judgment?
Exactly. We need to remember that AI is a tool,
Right.
and like any tool, it could be misused or misinterpreted.
Yeah.
Healthcare providers need to be trained to critically evaluate AI-generated insights
Right.
and use their own clinical judgment to make the final decisions.
So it's about finding that balance between leveraging the power of AI and maintaining human expertise.
Absolutely.
Okay.
It can't be one or the other. It
Yeah.
has to be both working together.
Yeah, and there's also the risk of widening the digital divide if we're not careful.
That's right.
If we only focus on developing these cutting-edge technologies
Yeah.
without addressing the underlying issues of access and affordability, we could end up creating a healthcare system that is even more inequitable.
Absolutely.
So it's not enough to just develop the technology we have to make sure it reaches the people who need it most.
Exactly.
Okay, so there are definitely some challenges to navigate,
Yeah.
but it sounds like the potential rewards are worth the effort. I'm feeling optimistic about the future of rural healthcare.
Me too.
Yeah.
I think we're on the cusp of a major transformation.
Yeah.
And it's exciting to be a part of it.
Yeah.
But ultimately, the success of these technologies will depend on human factors.
What do you mean by that?
I mean that it's not just about the algorithms
Right.
or the devices.
Okay.
It's about the people who use them.
Yeah.
It's about the doctors and nurses who are dedicated to providing quality care,
Uh-huh.
the patients who are empowered to take control of their health,
Right.
and the communities that come together to support each other.
So technology is just a tool, and it's up to us to use it wisely and compassionately.
That's exactly it. And I think if we can do that, then the future of healthcare, especially in rural communities, is incredibly bright.
Okay, so we've talked a lot about the big picture,
Yeah.
but I'd love to get a bit more specific.
Okay.
What are some of the real-world applications of telemedicine and AI that are already making a difference in rural healthcare?
There are so many great examples. One area where telemedicine is already having a huge impact is in mental health care.
Oh, that makes sense. Mental health services are often scarce in rural areas,
Yeah.
and the stigma surrounding mental health issues can make it difficult for people to seek help.
Right.
How is telemedicine addressing those challenges?
Well, with telepsychiatry,
Okay.
people can access counseling and therapy for the comfort and privacy of their own homes. This eliminates the need for travel,
Right.
reduces wait times,
Yeah.
and often make people feel more comfortable discussing sensitive issues.
That's so important. It removes so many barriers and makes mental health care more accessible for everyone.
Exactly. And studies have shown that telepsychiatry can be just as effective
Wow.
as in-person therapy
Okay.
for a wide range of conditions, from anxiety and depression to PTSD and substance abuse.
That's incredible. It's like bringing the therapist's office right into your living room.
It is.
Yeah.
And another area where we're seeing a lot of innovation is in chronic disease management.
Oh, that's a big one. Chronic diseases like diabetes, heart disease, and COPD are major health challenges,
Huge.
especially in rural areas.
Yeah.
How are telemedicine and AI being used to manage those conditions?
Well, telemedicine allows patients to have virtual checkups with their doctor,
Okay.
monitor their vital signs remotely,
Mm-hmm.
and get personalized feedback and support.
Right.
And AI is being used to analyze data from wearables and other sources to identify potential problems early on and adjust treatment plans as needed.
So it's about providing more proactive and personalized care even when the patient and doctor aren't physically in the same room.
Exactly.
Okay.
And this type of remote monitoring and management
Right.
can help patients stay healthier, avoid complications, and reduce the need for costly hospital visits.
That's a win-win for everyone.
Absolutely.
Are there any other specific examples you can share?
Sure, another exciting application is in the area of specialist consultations.
Oh, yeah. I remember you mentioned this earlier. It's about connecting rural patients with specialists who might be located hundreds or even thousands of miles away.
Exactly.
Yeah.
So let's say a patient in a remote area needs to see a cardiologist,
Okay.
but there isn't one available locally.
Right.
Through telemedicine, they can have a virtual visit with a specialist
Okay.
who can review their medical record,
Yeah.
conduct a real-time examination using video and other technologies,
Wow.
and provide expert advice and recommendations.
That's amazing. It's like bringing the entire world of medical expertise to even the most remote corners of the globe.
It really is, and this is just the beginning.
Wow.
As technology continues to evolve,
Yeah.
we can expect to see even more innovative applications of telemedicine and AI in rural healthcare.
I'm already picturing drones delivering medications to remote villages and robots assisting with surgeries in rural hospitals.
Okay.
Maybe that's a bit too futuristic, but it's exciting to think about the possibilities.
It is exciting, and I think it's important to remember that the future of healthcare isn't just about technology.
Yeah.
It's about people.
What do you mean by that?
I mean that technology is only as good as the people who use it.
Oh, okay.
We need compassionate and skilled healthcare providers who are committed to using these tools to improve patient care.
Right.
We need patients who are informed and engaged in their health,
Yeah.
and we need communities that are supportive and collaborative.
So technology and humanity working together to create a healthier future for everyone.
Exactly.
I couldn't agree more. Well, I think we've covered a lot of ground in this deep dive. We've explored the incredible potential of telemedicine and AI to transform rural healthcare.
We have.
And we've also acknowledged some of the challenges and ethical considerations that come with these technologies.
Absolutely.
But before we wrap things up, I want to leave our listener with something to ponder.
Okay.
What's one final thought-provoking question that you'd like them to consider?
Well, I think a good question is, how would you bridge that gap
Yeah.
between the promise of these technologies
Mhm.
and the reality of rural healthcare? What would it take to make this vision of accessible, equitable, high-quality care
Right.
a reality in your own community?
That's a great question to leave our listener with.
Yeah.
You know, it's not just about the technology itself. It's about how we use it to empower both patients and providers
Right.
and really create a healthcare system that truly meets the needs of rural communities.
I think it starts with awareness,
Okay.
understanding the potential of these technologies,
Mhm.
and advocating for policies that support their development and adoption.
Okay.
We need to push for broadband expansion,
Yeah.
funding for telehealth programs, and training for healthcare professionals.
It sounds like it's going to take a collaborative effort,
Absolutely.
bringing together policymakers,
Yeah.
healthcare providers, technology companies, community members to really create a shared vision for the future of rural healthcare.
We need everyone at the table to make this work. And, it's not just about the technology itself.
Right.
It's about the human element.
Yeah, we've talked a lot about the importance of human connection and empathy in healthcare. How do we make sure that these technologies, while powerful, don't lead to a more impersonal or fragmented healthcare experience?
That's a valid concern, and I think
Yeah.
it comes down to how we design and implement these technologies.
Okay.
We need to make sure that they're user-friendly, intuitive,
Hmm.
and focused on enhancing the patient-provider relationship,
Right.
not replacing it.
So it's about using technology to augment human connection, not to eliminate it.
Exactly. For example, imagine a telemedicine platform
Okay.
that incorporates features that promote engagement and connection,
Hmm.
like high-quality video and audio real-time language translation,
Okay.
and tools that allow patients to share their personal health stories and goals with their provider.
That's a great idea. It's about making the technology feel more human and less like just another screen.
And it's also about training healthcare providers to use these technologies in a way that fosters empathy and builds trust.
Right.
It's not just about learning how to operate the software.
Okay.
It's about understanding how to communicate effectively through a screen and create a sense of presence and connection.
So it sounds like we're talking about a whole new set of skills for healthcare providers in this digital age.
Right.
It's not just about being tech savvy, it's about being digitally empathetic.
Yeah, I love that term.
Yeah.
Digitally empathetic.
Okay.
I think that captures it perfectly.
Well, I'm feeling really inspired by this conversation. It's given me a lot to think about, not just in terms of the technological advancements, but also the human aspects of healthcare in the digital age.
It's an exciting time to be involved in healthcare.
Yeah.
And I think the potential for positive change is enormous, especially for rural communities that have long faced barriers to accessing quality care.
Okay, before we sign off, I want to circle back to our listener and I'll offer them one final piece of advice. If you're interested in learning more about telemedicine and AI in rural healthcare, there are some great resources available online. You can check out the websites of organizations like the American Telemedicine Association,
Yep.
the Center for Connected Health Policy, and the National Rural Health Association.
Those are excellent resources, and I would also encourage our listener to reach out to their local healthcare providers and community leaders to see what initiatives are already underway in their area.
Great advice. Getting involved at the local level can make a real difference. Well, that's a wrap on another fascinating deep dive. A huge thanks to you, expert speaker, for sharing your insights and expertise with us today.
This was my pleasure.
And to our listener, thanks for joining us on this journey of discovery. Keep those questions coming, and we'll see you next time for another deep dive into the world of knowledge.
Yeah, a really good question to think about. I mean, it's a challenge, right?
Right.
How do we take all this amazing potential
Yeah.
and actually make it work for people?
Yeah, for real people in real communities.
Exactly, and I don't think there's like a single answer.
Right.
It's going to be a combination of things. But I think it starts with awareness.
Okay.
People need to understand what's possible with these technologies and then start advocating for policies that support their development and adoption.
Right. So it's not just about the technology itself, it's about like the whole ecosystem around it.
Exactly. We need to push for things like broadband expansion,
Right.
funding for telehealth programs,
Yeah.
making sure healthcare professionals are trained
Yeah.
to use these tools effectively.
It really sounds like it's going to take a collaborative effort.
It absolutely will.
Bringing together, policymakers, healthcare providers, technology companies, and even just community members to create a shared vision for the future.
Yeah, we need all those stakeholders at the table.
Right. And it's not just about the technology itself. We've
Mhm.
been talking a lot about the human element
Right.
and how do we make sure that these technologies, while powerful, don't lead to a more impersonal or fragmented healthcare experience.
It's a valid concern I think a lot of people have.
Right.
And it really comes down to how we design and implement these technologies.
Okay.
We need to make sure that they are user-friendly, intuitive, and really focused on enhancing that patient-provider relationship, not replacing it.
So it's about using technology to augment human connection, not to eliminate it.
Exactly. For
Yeah.
imagine a telemedicine platform that actually incorporates features
Okay.
that promote engagement and connection.
Yeah, what kind of things are we talking about?
Well, you could have high-quality video and audio,
Right.
real-time language translation,
Okay.
even tools that allow patients to share their personal health stories and goals with their provider.
That's a great idea. It's about making the technology feel more human,
Exactly.
less like just another screen.
And it's also about training healthcare providers to use these technologies in a way that fosters empathy and builds trust.
Right. So it's not just about like learning how to click the buttons.
It's not just about the technical skills.
Yeah.
It's about understanding how to communicate effectively through a screen and really create that sense of presence and connection.
So it sounds like we're talking about a whole new set of skills for healthcare providers in this digital age.
Yeah.
It's not just about being tech savvy, it's about being digitally empathetic.
I love that term, digitally empathetic.
Mm.
I think you're right on the money with that.
Yeah.
It really captures it perfectly.
Well, I am feeling really inspired by this conversation.
Yeah.
It's given me a lot to think about, not just in terms of the technological advancements, but
Yeah.
also, like you said, the human aspects of healthcare
Absolutely.
in this increasingly digital age.
It's an exciting time to be involved in healthcare.
It is.
And I think the potential for positive change is enormous,
Yeah.
especially for rural communities that have faced so many barriers to accessing quality care for so long.
Well, before we sign off, I want to circle back to our listener
Okay.
and offer them one final piece of advice.
Mhm.
If you are interested in learning more about telemedicine and AI in rural healthcare, there are some great resources available online. You can check out the websites of organizations like the American Telemedicine Association,
That's a good one.
the Center for Connected Health Policy, and the National Rural Health Association.
Those are all excellent resources. And I would also encourage our listener to reach out to their local healthcare providers and community leaders
Okay.
to see what initiatives might already be underway in their area.
That's a great idea. Getting involved at the local level can really make a difference.
It can.
Well, that is a wrap on another fascinating deep dive. A huge thanks to you, expert speaker, for sharing your incredible insights and expertise with us today.
It's been a pleasure as always.
And to our listener, thanks for joining us on this journey of discovery. Keep those questions coming, and we'll see you next time for another deep dive into the world of knowledge.